Hello, Professor and fellow classmates. This is Jerry Schramm delivering my presentation on living with type 2 diabetes. What is diabetes? Diabetes is a disease that affects the pancreas, and it causes a limited or absent release of a hormone known as insulin. Without insulin, the body's organs, tissues cannot use the blood sugar extracted from the foods we eat. The body's main source of energy is sugar, and the insulin is important to transport that sugar into the body's organs and tissues. Without it, you wouldn't have the energy to do much of anything. Unregulated blood sugar levels can exacerbate conditions such as glaucoma, neuropathy, renal insufficiency, which leads to kidney failure, heart disease, stroke, and myocardial infarction or heart attack. Diabetes is divided into three types: type 1, type 2, and gestational diabetes. 9 out of 10 people have type 2 diabetes. With longer lifespans, women are more likely to develop type 2 diabetes, and women are more likely to be overweight and less physically active, two of the principal risk factors of type 2 diabetes. Some medical advice on how to manage type 2 diabetes. One of the greatest pieces of advice is to eat healthy, well-balanced meals, meals that consist of proteins, carbohydrates, eating small portions and often, making sure that they're the right choices. Develop the regular exercise routine. Be active. As you get up and you get moving and you get active, you're going to utilize that sugar. You're going to balance the amount of sugar that you ingest in those small meals, and you're going to be able to transport it. You're also going to be healthier. Your weight will be lower. Your blood pressure will be lower. The effect it has on your kidneys, the amount of arterial sclerosis that builds up in your arteries, all of that would decrease with regular exercise. Your HDLs, your high-density lipids, would be much higher in comparison to your LDLs, your low-density lipids, and that helps regulate your cholesterol, all tied into healthy diet and exercise. And you want to check your blood sugar levels daily. Make sure that your sugars are running where they need to be. A healthy blood sugar is right in the 100 to 120 range. Learn and incorporate stress management techniques. Stress can increase blood sugar readings, and by all means, stress management techniques would help keep that stress low and have a positive effect on your blood sugar. Have your A1C levels checked every 3 months. This provides a good timetable stamp of how well your sugars are doing quarterly throughout the year. And participate in support groups that understand your disease and help you understand your disease. Living with the disease. I had to interview a woman who lives with type 2 diabetes. I chose my mother. My mother's name is Debbie, and she's been living with type 2 diabetes for about the last 6 years. She's 59 years old, grandmother of 8, living with type 2 diabetes. My mother's overweight. She has hypertension or high blood pressure, neuropathy, hyperlipidemia, high cholesterol, diverticulosis, which affects the intestines, and diabetes. She has a family history of diabetes with both her mother and brother diagnosed with type 2 diabetes. Coincidentally, my grandmother suffered from unmanaged diabetes and eventually died following a stroke. So diabetes is pretty near and dear in my family, and management is very important. She knows some of the greatest challenges of managing diabetes is remembering to eat every 3 hours and to eat the right foods. You have to have a good balance of your proteins and your carbohydrates. Proteins and carbohydrates together slowly absorb sugar rather than one quick burst of sugar with carbohydrates, or slow absorption and not enough sugar released through just proteins. Debbie explained that she has not been managing her diabetes well because of a lapse in insurance. She didn't have insurance from November until about May of this year. During that time, she wasn't able to have access to have her A1C levels checked and to have glucometer strips, to have a support group. But now that she has her insurance, she attends a support group, meets with a diabetic educator. She builds out a menu with that diabetic educator, and it teaches her how to manage her diabetes. Debbie also has dentures, and she has the diverticulosis, which regulates the different varieties of food she can eat. So the diabetic educator helps pick the foods that she can eat, the foods that will work well with her diverticulosis, and she's able to then manage her diabetes more effectively. She's been able to have her A1C glucose levels checked. Blood tests are very expensive when you have to pay out of pocket, so she wasn't able to do that before. And her ideal range is 6.1 to 7. However, she had her highest reading ever at 7.1 on her last check. I asked Debbie what would be her advice to other diabetic women, if she had to offer some, or to us students. And she said, you need to be accountable and you need support. She said women worry about everything and everyone but themselves. And with children and husband, family, and other obligations, she said that there's always something to do besides worry about you. So that was some good pieces of advice. She said don't skip meals, remember to check your blood sugar levels daily, and take your medicines as prescribed. She says it's pretty easy to forget those things when the grandkids are calling for your attention and you're making lunches for them, and before you know it, it's been 5-6 hours since you ate last. If you catch diabetes early, Debbie says it's important to go to the classes and you can manage this diabetes. You would support one another and you avoid needing medication. It's important to catch it early and be accountable to yourself and to the disease. The person I interviewed for a person managing women with diabetes was Jackie Pitcher. She's an LPN and a wellness coordinator at Freedom Village in Brandywine, which is an independent living community. Her responsibility, she oversees the medication management of the residents, health and wellness of over 320 independent living residents. She delivers presentations monthly, little group presentations, as well as they have an in-house television station. She does little presentations on the television station, and she does some one-on-ones as well. She monitors residents for their mental, cognitive, and physical changes to see if anything's different, and she's a point of contact for staff and family who may have questions. She works collaboratively with the management team to maintain overall resident health. Some of the challenges she offered that she has with women with diabetes is non-compliancy. She says that women are horrible in comparison to men with being compliant. Many don't take medications as prescribed. They don't adhere to a proper diet, and they must agree to receive help in this community, or you can't force it upon them. She offered that there's women who they eat what they want, and then they try and balance out their insulin by just eyeballing it. Well, I ate an extra piece of cake today, I guess I'll take an extra dose of insulin, which obviously everyone can appreciate what kind of an impact that has. But it leads to health concerns, more frequent healthcare needs, and more time spent handling logistics with those who are non-compliant. She needs to develop more education, contact family, develop support groups. It's just a lot of back-end stuff that would be alleviated if people were more accountable and she was able to just provide that education to the person themselves. Her advice: it's important to understand the disease and how to care for a person with the disease, but it's more important to teach them to care for themselves. She says to learn techniques to help overcome non-compliancy and the skills to encourage seniors to want to be healthy for themselves and learn how to manage their own diseases. The Affordable Care Act and diabetes. President Obama implemented the Healthcare Initiative, Affordable Care Act, or Obamacare, to help the uninsured. He successfully decreased the number of uninsured people from 16.2% in 2013 to 10.7% in 2015. Had a substantial impact. It helped a lot of people gain insurance, but it also drove up the insurance premiums to levels that it's over 3 million people cannot afford. Without insurance, people like Debbie, they can't afford their medications, diabetic education, the support groups, the routine blood work, the glucometer strips. It's just unaffordable. She's forced to manage her diabetes or pay her bills, and it's a hard choice. So those folks like Debbie, they fail to manage their diabetes. They develop additional ailments affecting vision, kidneys, and heart, like I mentioned earlier. Diabetes can control you, or you can control it. Debbie made that clear. Take control, be accountable. Proper education, exercise, diet, and accountability will allow women to live a long, healthy life. And non-compliancy is the single greatest struggle in the management of diabetes, as Jackie Pitcher offered. Access to medical care is something that most take for granted, but for women with diabetes, the high cost of health insurance can make a life-saving difference. These are some of the references I was able to utilize. That's the end of my presentation. I appreciate you listening, and I hope it helped.